Dear students, welcome back. In this session, we are going to discuss about pelvic diaphragm. Okay, the pelvic diaphragm is also called as pelvic floor. Okay, the pelvic floor is a funnel-shaped structure. Pelvic floor is a funnel-shaped structure. So this is the coronal section of the anterior aspect of the male pelvis. Here you can find such kind of pelvic floor muscles. Okay, these are the pelvic floor muscles. So the pelvic floor is a funnel shaped structure. It attaches to the walls of the lesser pelvis, which is a true pelvis, isn't it? Lesser pelvis separating the pelvic cavity. So this entire one is the pelvic cavity from the perineum. So this part is called as perineum. So here we'll find the perineum part. Okay, and this one is pelvic cavity. So this pelvic diaphragm separates the pelvic cavity from the perineum. Okay, in this perineum, which is the region which includes the genitalia and the anus. Okay, so normally the perineum we can see only in the lithotomy position, isn't it? Yes. Okay, so in that perineum we'll have some holes called as urogenital hiatus. So in the perineum we'll have the urogenital hiatus. Okay, an anteriorly situated gap which allows the passage of urethra. Normally the perineum appears like this in the lithotomy position, and you'll find an hiatus, urogenital hiatus, for the passage of urethra. In females, you'll find another opening called as vagina is also present. Okay, and another one is the rectal hiatus. Okay. This one is a centrally positioned gap which allows the passage of anal canal. Okay, between the urogenital hiatus, between the urogenital hiatus as well as the rectal or anal canal, we can say, anal canal, lies a fibrous node. Here a node is present known as perineal body, which joins the pelvic floor to the perineum. So this pelvic diaphragm on both sides are joined to perineum by a node called as fibrous node called as perineal body. Okay, this is about the introduction of pelvic diaphragm, or pelvic diaphragm is also called as pelvic floor structure. Okay, how this pelvic floor is formed? Normally this pelvic floor is formed by the pelvic diaphragm, which consists of Levator Ani muscles and the coccygeus muscles. Okay, so it appears as a gutter because it slopes from either side, so on either side and towards the median plane, where it is traversed by the urethra and the anal canal. So this is the traversing. Okay, if in females, vagina is also present. Okay, in between urethral hiatus, vagina, and the anal canal, you can find this separation. Okay, now we will see how the floor is formed. Okay, a number of muscles help make up the walls of this normally pelvic cavity. So we are considering only about the pelvic floor muscles. What are the other muscles which forms the pelvic floor? One is the obturator internus and piriformis muscle. Okay, so that one, those muscles are present in the true pelvis. Okay, so now we are only discussing about the pelvic floor muscles. So this is the superior view. We can say it is called as bird's view. In the superior view, we can find this pelvic floor muscles, which are given in different colors. This is the pubic symphysis. Okay, this is the anterior, and you can find here the sacrum, as well as here you can find the coccyx. Okay, sacrum and coccyx you can find here. So anteriorly you find the levator ani muscles, and posteriorly you can find the coccygeus muscle. Okay, all together, all these muscles on both the sides, right side as well as left side, all together forms the floor of the pelvis, or we can call it as pelvic diaphragm. So the levator ani consists of a group of muscles called as puborectalis, pubococcygeus and iliococcygeus, all together called as levator ani muscles. And we have already discussed about one of the important function of this puborectalis, isn't it, which helps in the rectum. Okay, in the rectum sphincters. Okay, yes. Next one, this pelvic floor is covered by the pelvic surface, pelvic fascia, both the surfaces of the pelvic diaphragm, that is superior surface as well as the inferior surface. Both the surfaces are covered by the pelvic fascia. Okay, the inner fascia. So this one is the superior fascia, superior aspect. This one is the superior aspect. Now we are seeing. So below this one, we have the fascia that is called as anal fascia. Okay. Yes. Yes. So in general, the fascia of the pelvic floor is loosely arranged between the peritoneum and pelvic floor, forming a dead space for distension of the bladder, the rectum, and the uterus and the vagina. Okay. Because of the loose nature of this fascia, infections can spread rapidly within. Okay. And also, these muscles, so this pelvic viscera, normally over this surface, so this is the actually these muscles are covering the outlet of the pelvis, isn't it? Outlet. Okay. Now normally over this the pelvic viscera is located, so like bladder, rectum, pelvic genital organs, and also the terminal part of the urethra, which resides within the pelvic cavity. So we are seeing above, so all these structures are present on the pelvic diaphragm. Okay. Yes. And now we will see all these muscles origin, insertion, nerve supply and its actions, and also we are going to discuss about the functions of this pelvic diaphragm. So now we will see the levator ani muscles. So in this picture we can see the levator ani muscles. So all these levator ani muscles are originating from the pelvic surface of the pubis. This is the pelvic surface of the pubis, and also the obturator fascia, and the spine of the ischium. All these fibers are getting originating here. The levator ani muscles are getting originating here. And if you see the insertion, the fibers arch backwards and medially. So these fibers arch backwards and medially. So these fibers arch backwards and medially. In the male, the most anterior fibers run across the sides of the prostate gland to end in the perineal body. Okay. In females, the corresponding fibers passes across the sides of the vagina to end in the perineal body. Okay. The intermediate fibers pass along the sides of the rectum. So the intermediate fibers passes along the sides of the rectum. Okay. And become continuous with those of the opposite side behind the anorectal junction. Okay. So they form the puborectalis muscle. What you call as? They form the puborectalis muscle. They merge with the internal and external sphincters of the anal canal to form the anorectal ring. Okay, the most posterior fibers are attached to the coccyx. The most posterior fibers are attached to the coccyx and to a fibrous band called as anococcygeal ligament. So these are the origin and insertion of this levator ani muscle, and these muscles are supplied by fourth sacral nerve and also inferior rectal nerve, which is a division of pudendal nerve, inferior rectal nerve. If you see the action, along with coccygeus, it forms the pelvic diaphragm. It supports the pelvic viscera. It acts as a sphincter for rectum as well as the vagina. So these are the origin, insertion and functions of the levator ani muscles. If you see the coccygeus, the origin is from the ischial spine. Okay. And insertion, if you see the insertion, it is going to insert on the lateral margins of the coccyx. Okay. And also the last piece of the sacrum. This is the insertion of coccygeus. And this muscle is supplied by S4 and S5 sacral nerves. Okay. If you see the action, again this one helps in the formation of pelvic diaphragm, pulls the coccyx forward after it has been pushed back. Okay. So these are the actions of these muscles. If you see the overall functions or actions of levator ani as well as coccygeus, these muscles close the posterior part of the pelvic outlet. The levator ani fix the perineal body and support the pelvic viscera. During coughing, sneezing, lifting and other muscular effects, the levator ani and coccygeus resist the increased intra-abdominal pressure and help to maintain continence of the bladder and the rectum. And the coccygeus pulls forward and support the coccyx after it has been pressed backwards during defecation, parturition, which is nothing but childbirth. These are the main functions of this pelvic diaphragm. If you see some of the clinical anatomy, the pelvic diaphragm is subject to great stress during childbirth. It can be damaged or weakened. A weakened pelvic diaphragm can lead to prolapse of the uterus. That means the uterus is not present in its place and it is going to prolapse down through their openings, or prolapse of the rectum we can see if there is any weakened diaphragm. This is all about the pelvic diaphragm. Thank you.